Hi, I'm Alan Bell. I'm a family doc in Toronto. I'm an assistant professor in the Department of Family and Community Medicine at the University of Toronto, and I'm on the executive committee of Thrombosis Canada.
Hello, my name is Dr. Jim Duquetis. I'm an internist and vascular medicine physician at St. Joseph's Healthcare Hamilton and a professor of medicine at McMaster University.
Hi there, my name is Dr. Vivian Brown. I'm a family doctor in Toronto, Ontario, Canada.
My name is Bill Geertz. I'm an internist and thrombosis specialist at Sunnybrook Health Sciences Centre in Toronto.
Hi, I'm Jeff Habert. I'm a family physician in Thornhill.
Hi there, my name is Menaka Pai. I'm a hematologist and a thrombosis consultant from Hamilton, Ontario, and an assistant professor at McMaster University.
I'd like to take this opportunity to introduce you to the new Thrombosis Canada. For over 2 decades, the Thrombosis Interest Group of Canada has been dedicated to fighting the massive human burden of vascular disease by furthering education to healthcare professionals of evidence-based strategies to reduce the impact both of arterial and venous vascular disease.
I've been involved with the Thrombosis Interest Group of Canada and now Thrombosis Canada for over 10 years. Thrombosis Canada is a non-profit, non-commercial organization consisting of internists, family physicians, pharmacists, and nurses who are dedicated towards furthering education and research in thrombotic disorders and ultimately improving the care of patients with these conditions.
Thromboembolic disorders are extremely common, and antithrombotic agents are among the most commonly used drugs. At the same time, knowledge in this area is rapidly expanding, and there's a real need for a national voice that reviews current practices in thrombosis and provides healthcare providers with up-to-date and practical summaries of diagnosis, treatment, and prevention of thromboembolic disorders. Thrombosis Canada represents that voice in Canada.
We've come to realize that we need to focus our effort toward an immediate impact on patient care at the point of care, so much of which occurs in the family physician's office. To reflect that new focus, we've rebranded the Thrombosis Interest Group of Canada to Thrombosис Canada, with a mandate to support all clinicians, but with a focus on primary care to impact the burden of vascular disease in Canada. To achieve our mandate, Thrombosis Canada has created a complete set of evidence-based clinical guides, written by globally recognized experts, suitable for use in primary care, but applicable to all specialties and other healthcare professionals, designed to be robust, yet concise enough to be applicable at the point of care.
Thrombosis Canada is now focused on providing clinical guides for a wide spectrum of topics relating to the diagnosis and treatment of venous and arterial thrombotic disease and the management of patients who are receiving anticoagulant or antiplatelet drugs. A key focus of the clinical guides is helping healthcare professionals manage patients who are receiving new oral anticoagulant drugs, which include dabigatran, rivaroxaban, and apixaban, and the new oral antiplatelet drugs, which include prasugrel and ticagrelor.
So what are the purpose of these guides? What is it that Thrombosis Canada has created? Well, basically, there are multiple questions that come up every day in everyone's office as we see vulnerable, ill patients on multiple medications. And the goal was to create guides that explained the information on the disease states and also explain the information on the multiple medications and multiple choices that we could make. In this way, the guides truly provide me with the confidence to make a complex decision on a complex patient, knowing that I'm following Canadian standards, that I'm following evidence-based medicine, and it's almost, not quite, but almost like having a consultant in the office with you. I think in family practice, one of the most important things we learn early on is to have confidence in what we know and to be very clear about what we don't know. And when we're not sure about a medication, the side effects of the medication, when we're not sure about the drug interactions, something like Thrombosis Canada's guides can help us make a decision.
I think these guides are very user-friendly. I can simply log into the Thrombosis Canada website, or alternatively, I can use my iPhone app. Common things that I would look up in the office are general dosing of the NOACs, the new oral anticoagulants, or general dosing of the NOACs in chronic kidney disease, which is a very common problem faced in family practice.
And that's why we've put so much energy into creating our clinical guides. They're practical, concise summaries of the evidence that will tell you exactly what you need to know to manage patients with thrombosis. I was really excited to be part of developing these clinical guides. My role was to ensure that they were relevant to all healthcare professionals, particularly those in primary care. They are up to date, like many evidence-based web resources that you may be using already. And they also summarize best available evidence, just like clinical practice guidelines. But Thrombosis Canada's clinical guides are different. They don't just focus on literature review. They're much more concise, and what they emphasize is giving you a clinical bottom line. So they tell you as the clinician exactly what you need to know to manage the patient in front of you. So you can pull up one of our clinical guides easily on your computer, your smartphone, or your tablet device. Then you can review it and act on the recommendations, all while the patient is sitting right in front of you in your busy office.
To bring the guides to the point of care, we offer them without cost at our website at www.thrombosiscanada.ca. Of course, the full website will be accessible on any computer, but is also designed to recognize portable devices and is appropriately formatted when you access it on your tablet or phone. Distinct from the website is the Thrombosis Canada app, downloadable free from the website or soon to be available on online stores from Apple, BlackBerry, and Android. Again, free of charge. We welcome you, we encourage you, we invite you to allow us into your practices as the go-to source for information and point-of-care advice on thrombosis management. Please visit us at www.thrombosiscanada.ca, download the app, get involved.